Did you know that heart disease is the leading cause of death worldwide? According to the American Heart Association, nearly 6.7 million adults in the United States live with heart failure, and globally the number is climbing past 64 million cases. That means millions of people, maybe even you or someone you love, are at risk every single day. And here's the shocking part. Many of the foods we believe are healthy, even certain fruits, may actually harm your heart if eaten in excess. Yes, you heard that right. Not every fruit is a friend to your heart. Some of them can quietly push you closer to heart disease, heart failure, or stroke. Therefore, in today's video, we'll explore 7 fruits you must avoid for better heart health, because these fruits silently damage your heart and lead to heart failure. These are backed by the latest studies and research. Trust me, you'll be surprised by some of them. We often hear that fruits are always healthy, but here's the truth. Not every fruit is your friend, especially if you're over 50 or already dealing with high blood pressure, diabetes, or cholesterol. Some fruits, because of their sugar content, glycemic load, or potassium levels, can silently stress your heart. Dr. Stephen Nissen, a leading cardiologist from the Cleveland Clinic, has warned that even natural sugars, if taken without balance, may accelerate heart disease risks. In a 2019 study published in the Journal of the American College of Cardiology, highlighted how high fructose intake can trigger metabolic changes linked to heart failure. So in today's video, we'll explore 7 fruits you must avoid for better heart health. Trust me, you'll be surprised by some of them. Before we begin, tell me your age and location in the comments. This helps us understand how heart health is affecting people around the world. Don't forget to like this video, subscribe to the channel, and hit the bell icon so you never miss life-saving health information that could protect your future. Number 1. Grapes, the hidden sugar bomb. Now let's start with a fruit many people love, grapes. They're small, sweet, and often called nature's candy. But here's the problem. Grapes are packed with fructose, a natural sugar that, in large amounts, can overload your system. For someone over 50, especially if you're dealing with high blood pressure, prediabetes, or obesity, eating too many grapes may increase your blood sugar spikes. Over time, these spikes contribute to insulin resistance and make your heart work harder. A study in the Journal of the American Heart Association, 2017, found that diets rich in high glycemic fruits like grapes were linked to higher cardiovascular risk compared to low glycemic fruits such as apples or berries. Dr. Robert Lustig, a professor of pediatric endocrinology at the University of California, has long warned that sugar, even in fruit, can act like a slow poison when consumed without limits. Grapes may look harmless, but a handful can equal the sugar content of a candy bar. The real danger? Many seniors snack on grapes mindlessly, watching TV, reading, or simply keeping them on the table. That means sugar overload without realizing it. And for those with weakened heart function, the excess glucose and weight gain can accelerate heart failure progression. So what's the smarter choice? If you love grapes, limit your portion to just a few and pair them with protein-like nuts to balance the sugar release. Remember, moderation is key. Your heart deserves better fuel than hidden sugar bombs. Number 2. Bananas. Too much potassium can be risky. Bananas are one of the most popular fruits in the world. Easy to peel, easy to eat, and often called a super snack. But for people over 50, especially those with heart problems or kidney issues, bananas can be more harmful than you think. Why? Bananas are loaded with potassium. Now, potassium is usually a good thing. It helps control blood pressure and keeps your muscles working. But here's the catch. When your heart or kidneys are weak, your body struggles to manage high potassium levels. This condition, called hyperkalemia, can cause dangerous heart rhythm problems and, in severe cases, even lead to sudden heart failure. A report in the Clinical Journal of the American Society of Nephrology, 2020, explained that excess dietary potassium in older adults with reduced kidney function significantly increases cardiovascular risk. Dr. Martha Galati, a well-known cardiologist and past president of the American Society for Preventive Cardiology, has also noted bananas are healthy, but for people with heart or kidney disease, they can become risky if eaten too often. Another issue is their glycemic index. A ripe banana can raise your blood sugar quickly, which adds stress on the heart, especially if you're diabetic or pre-diabetic. Here's the takeaway. If you love bananas, don't eat them daily. One small banana a few times a week is safe for most people. But if you already have heart failure, kidney problems, or are on medications like ACE inhibitors or diuretics, talk to your doctor before including bananas in your diet. Sometimes avoiding them is the safer path. Number 3, pineapple, the acidic sugar spike. Pineapple looks tropical, tastes refreshing, and is often seen as a healthy dessert. But when it comes to heart health, especially in older adults, this fruit can be more dangerous than it appears. The first concern is sugar load. Pineapple has one of the highest glycemic indexes among fruits, meaning it raises blood sugar quickly. For people over 50 with diabetes or insulin resistance, this spike can damage blood vessels, stiffen arteries, and increase the risk of heart failure over time. A 2018 study in the journal Nutrients confirmed that high glycemic fruits like pineapple contribute to metabolic stress, which is directly linked to cardiovascular disease. Second, pineapple is very acidic. While acidity itself doesn't damage the heart, it can cause acid reflux. This may seem like a stomach problem, but constant reflux can irritate the esophagus and mimic chest pain, sometimes confusing it with heart-related discomfort. For seniors with fragile health, this overlap can create unnecessary anxiety and strain. Dr. Dariush Mozaffarian, a cardiologist and researcher at Tufts University, has often reminded patients that not all fruits are equal in their impact on metabolism. Pineapple, because of its sugar-acid combination, is one that should be eaten with extreme caution. The bottom line? If you enjoy pineapple, keep it small, just a few chunks with a balanced meal. Never consume large amounts in juice form, as juices concentrate the sugar and remove the fiber that slows down absorption. For someone protecting their heart, avoiding frequent pineapple indulgence is a smart step. Number 4. Watermelon is sweet but stressful for the heart. Watermelon is refreshing, hydrating, and a summer favorite. Most people think it's the perfect fruit for hot days. But here's the hidden truth. Too much watermelon can silently stress your heart. The first issue is its high glycemic load. While watermelon is mostly water, it still contains a good amount of fructose. Eating large portions, like big bowls or daily slices, can cause quick spikes in blood sugar. Over time, this repeated stress damages blood vessel linings, hardens arteries, and increases heart disease risk. A 2016 study in the American Journal of Clinical Nutrition showed that fruits with higher glycemic loads, such as watermelon, contribute to higher insulin resistance, a key trigger for heart problems. Another danger is overhydration. Watermelon contains about 92% water. For healthy people, that's usually harmless. But for adults over 50 with weaker kidneys or heart failure, eating too much can lead to fluid overload. Extra fluid forces the heart to pump harder, making conditions like congestive heart failure worse. Dr. Clyde Yancey, former president of the American Heart Association, has warned, when the heart is failing, even seemingly healthy choices like excess fluid intake can tip the balance against you. That means large servings of watermelon may not be as innocent as they look. The solution? Enjoy watermelon in small slices, not half a melon at once. Avoid eating it late at night when your body's less active, as this makes blood sugar management harder. And if you have heart or kidney disease, consult your doctor about how much watermelon is truly safe for you. Number 5. Oranges. Too much vitamin C and acid oranges are one of the most iconic healthy fruits. Rich in vitamin C, often recommended for immunity, and easy to snack on. But here's what many don't realize. Too many oranges can put your heart at risk, especially if you're over 50. First, let's talk about sugar. A medium orange contains about 12 grams of sugar. That may sound small, but many people don't stop at one. Drinking orange juice or eating multiple oranges daily can quickly double or triple that intake. A 2019 Harvard study in Circulation reported that people who regularly consume fruit juices, like orange juice, had a higher risk of cardiovascular mortality compared to those who consumed whole fruits in moderation. The reason? Rapid sugar absorption without enough fiber stresses the cardiovascular system. Second, oranges are acidic. In people with acid reflux or GERD, frequent orange consumption can trigger chest burning and discomfort. For seniors, these symptoms can feel very similar to angina, heart pain, creating confusion and unnecessary emergency visits. Dr. Frank Hu, chair of nutrition at Harvard T.H. Chan School of Public Health, has explained that fruit sugars, even from juice, act very differently than when consumed in small amounts from whole fruits. This means your morning glass of orange juice might not be as heart-friendly as you think. The safe choice? Stick to one small orange a day and avoid frequent fruit juices. If you already have diabetes, high blood pressure, or heart disease, it may be better to limit oranges altogether and swap them for lower sugar, less acidic fruits like berries or apples. Number 6, cherries, the tiny fruit with big sugar. Lode's cherries look harmless, small, juicy, and often labeled as antioxidant rich. But for older adults, especially those with heart issues, cherries can be a hidden danger. Here's why. Cherries are extremely sugar dense. A single cup of sweet cherries can contain up to 20 grams of sugar, almost the same as a chocolate bar. For seniors with diabetes, high cholesterol, or heart failure, this sugar rush can push blood glucose levels sky high, causing inflammation and damaging blood vessels. Over time, that accelerates atherosclerosis, plaque buildup in arteries, which leads to heart attacks and strokes. A 2019 study in the journal Nutrients found that diets high in fructose from sweet fruits, like cherries, were linked to increased triglycerides, a fat in the blood strongly tied to cardiovascular disease. Dr. James DiNicolantonio, a cardiovascular research scientist, has repeatedly warned that fructose, even from fruit, can overwhelm the liver, raise blood pressure, and worsen heart disease when consumed in excess. Another issue is portion control. Cherries are so small and tasty that people often eat them by the handful, losing track of how many they've consumed. That turns a healthy snack into a sugar bomb before you know it. The safe approach? If you really enjoy cherries, limit yourself to just a small handful, 5 to 6 pieces, as an occasional treat. Not a daily habit, and never replace meals with a big bowl of cherries. Remember, the heart needs balance, not overload. Number 7, dried fruits, concentrated sugar traps. When we think of dried fruits like raisins, dates, figs, or dried apricots, we imagine them as natural snacks, often marketed as healthy energy boosters. But here's the hidden truth. Dried fruits are some of the worst offenders for your heart. Why? Drying fruit removes water, but keeps all the sugar. That means just a small handful of raisins or dates delivers the sugar load of several fresh fruits combined. For example, 1 cup of raisins packs over 85 grams of sugar. That's more than twice the sugar in a can of soda. This concentrated sugar causes sharp blood sugar spikes, increases insulin resistance, and promotes fat buildup around the liver and arteries. A 2015 study in the Journal of Nutrition and Metabolism highlighted that diets rich in dried fruits were strongly linked to higher triglyceride levels and greater risk of metabolic syndrome, a major pathway to heart disease. Dr. Dean Ornish, a famous cardiologist and researcher, has explained, even natural sugars, if consumed in concentrated forms, can accelerate heart damage and fuel inflammation. For seniors, especially those with weakened hearts, this is like pouring gasoline on a slow-burning fire. Another risk? Dried fruits are easy to overeat. They're small, chewy, and addictive. Before you know it, you've eaten a full day's worth of sugar in minutes. The smarter move? Avoid dried fruits if you're serious about protecting your heart. Choose fresh, fiber-rich fruits like berries or apples instead. And if you must eat dried fruits, keep the portion as tiny as possible. Just a few pieces, not handfuls. Conclusion: protecting your heart starts with smarter choices. So let's recap. We've uncovered 7 fruits you must avoid, or at least strictly limit, for better heart health. Each of these may look innocent on the surface, but when eaten in large amounts, especially if you're over 50, they can trigger sugar spikes, overload your heart, raise potassium to dangerous levels, or fuel metabolic stress that leads to heart failure. The lesson here isn't to fear all fruits. Instead, it's about balance and knowledge. As Dr. Dariush Mozaffarian from Tufts University has said, the type and amount of fruit matters greatly for heart health. Backed by journals like Circulation and the American Journal of Clinical Nutrition, the evidence is clear. Moderation and the right choices can protect your heart. Remember, your heart is your life's engine. It beats more than 100,000 times a day to keep you alive. The least we can do is fuel it with foods that heal, not harm. That means limiting high sugar or high potassium fruits and focusing on safer options like berries, apples, or pears. If you found this video helpful, please like it right now, subscribe to our channel, and hit the bell icon. And I'd love to know, what's your age and location? Comment below so we can see how heart health challenges look across the world. This video was created after long, careful research, but we can't include every study here. For those who want to dive deeper, we've added links to medical journals and expert references in the description. Take care of your heart. It's the only one you've got.